Good afternoon, ladies and gentlemen. Welcome to today's session on the roles of chaplaincy in healthcare. Our speaker today is Reverend John Wenga. He's the Senior Assistant Chaplain in Kenyatta National Hospital. And I thought this is a long overdue topic for us to start discussing in the healthcare department. Last week, we discussed about laws. So they affect our healthcare system. So this week, we're going to discuss about chaplaincy and the role of chaplaincy. I remember when I started in medical school, I used to see Father Kariba and always assumed he's a volunteer. And when I joined Kenyatta, that's when I actually got to find out he's an employee of Kenyatta. And there are many more as I went to the administration. And slowly but surely, the team is increasing and it's also diversifying. So today, we're going to have our first session with Reverend John Wenga, who has a lot to discuss from chaplaincy from a hospital in Kenya, and probably give us a brief history of how long we've been having chaplaincy in Kenya. And I'm really eager to hear and learn from you, Reverend. So welcome.
Okay, thank you, members. And I thank you, Dr. Amina, for liaising with us so that we can share on our role, and especially in this institution and other institutions who engage the services of a chaplain. As Amina said, I'm Reverend Wenga. I'm the chaplain at Kenyatta. And I joined some years back, and the role of the chaplain in Kenyatta is established. This is not something that is beginning, but we are continuing, which is continuing. Kenyatta chaplain is as old, I think it's as old as Kenyatta. But when it comes to the issues of making progress and developing, that one, there's a lacuna somewhere. And that's why I thank Dr. Amina for trying to bring this topic on board so that majority of us can, yes, I'm going to share the slides. I can be around so that I can bring them on as I continue. Need to share them from my computer. Am I going to be around from that side to share all? Hello?
Yes, Father. Yes, Father, you can share from your end.
Let me check. Files, not. I think there's let me see. Yeah.
We can we can see your screen, so maybe you can just go to the presentation.
I'm trying to go to my
You
PowerPoint.
don't need to go to Zoom. Yeah. Okay. So
I just want to get my PowerPoint.
Okay.
The one I've prepared. I don't know, how do we go about it? I'm getting mixed up.
If you could share with me, I wouldn't mind assisting you.
So I send you through.
You can tell me. Let me just share my email.
Can you send me your email?
Yeah, let me do that right now.
Yes, just
Sorry.
do that.
Yeah. So maybe you can start the conversation while doing that, if it's possible.
Okay. Let me get let me go to the email then. Sorry for this. We are going to get out of it soon.
No, Reverend, it's very much okay. No pressure. So let me just.
Yeah. Okay, send me your email. Yeah.
I just sent you the research one so that Nelson can be able to see it and share.
Oh, thank you. Let me come. The first one involves the meaning and practice of spiritual care, so that we know what is this animal. What is this animal known as spirituality, known as the activities or the practice of the spiritual care. Number two, now I'll go to the functions and activities of hospital chaplains. Which areas and what activities the hospital chaplains or spiritual caregivers in a hospital setting participate in, or what do they accomplish? What makes them, in other words, relevant in an hospital setting where other medical practitioners are? Obviously, I know here is where there are a lot of questions, because what the chaplains is involved not in the practice or involving like what the doctors are involved in. They are involved directly with the patients, and especially what is really disturbing them inside and helping them to come out into the dilemma or the challenges which they are facing. So it is not something that needs to use instruments and the rest. Then finally, I will discuss the benefits of spiritual care provided by chaplains. After accomplishing that, what then can we say the benefits of having chaplains in a hospital? Next slide. Next slide, yes. As we begin, regarding the role of the chaplains in healthcare is something also which is documented in the World Health Organization, and especially the one which was published in 1998, which is not very far, which recognized that until recently, I quote, the health professionals have largely followed a medical model which seeks to treat patients by focusing on medicines and surgery, and gives less importance to beliefs and to faith in healing, in the physician and in the doctor-patient relationship. This reductionism or mechanistic view of patients as being only a material body is no longer satisfactory. Patients and physicians have begun to realize the value of elements such as faith, hope, and compassion in the healing process. The value of such spiritual elements in health and quality of life has led to research in this field in the attempt to move towards a more holistic view of health that includes an immaterial dimension, emphasizing the seamless connections between mind and body. So, in other words, bearing in the mind that the World Health Organization has also recognized the role of spirituality in healthcare, which is played by the chaplains, it becomes so important that we recognize in our health cares the role played by the chaplains. And I think that's why I really thank those who have organized to bring this out so that we can begin now digging. As the World Health Organizations have reported, that there is also another dimensions apart from the mechanistic way of dealing with the patients. As they have said, there is also another dimensions which is so important when it comes to the treating and also the healing of the patients we normally receive. So I therefore continue now the hand to try to elaborate more. What do we mean by the spirituality when it comes to healthcare? Before I come now to how the chaplains now intervene on the same. Let us go to the next slide. As we have cited, following the WHO assertion, it means therefore the place of psychological, psychosocial, and spiritual support in the recovery of patients cannot be overstated. So in other words, by them coming and having that quote we have read, it means that in a health center or sector, spirituality or spiritual support is something we need not to ignore. We say, by the way, as I've heard some people say, by the way, that is spirituality. It is spiritual, and spiritual, how does it operate in the science? But we can see from now the body entitled with taking care of that, of health, of human beings in the world, they have started to recognize that spirituality in health is something which cannot be ignored. And therefore, what we mean by when we say we bring in the issue of holistic health of human. Here, when we refer to formation of human beings, it entails the wholeness of the body, mind, and spirit. All these coordinate to make us who we are. And therefore, spiritual care at the hospital is about providing the patient with hope, strength, which translates to meaning in life. Here, what we mean when it comes to spiritual care in the hospital, we address the whole person, the whole person. We address the whole person in this sense. Here, we have now the medical part of it, or the medical part of addressing the patient. Then we have the counselors when it comes to the issues of mind, trying to address what goes around when somebody is hospitalized. And when somebody is faced with a serious or a chronic illness, here the question of spirituality again comes in. And that's from that point, the patient starts to find the meaning of his existence. And that is the point now. The role of spirituality comes in to address such concerns. So therefore, hospital chaplaincy provides the patient with a holistic and a patient-centered approach to care alongside the medical attention they receive at the facilities. So both they interrelate And that's why in most cases, when we are addressing or when you are doing our clinic or ward rounds, we have the place for doctors in the medical attention. And then when we go around, then we feel now the other part of the spiritual concern, which the patients now receive from the chaplaincy. This helps, again, to prioritize the patient's health when addressing now the spirituality alongside other concerns, safety, and over a personalized experience. So when we address the body, mind, and spirituality in healthcare, that is what we normally bring in. That safety of feeling I'm secure in this institution, because all dimensions of patients concerned are addressed, then that experience really facilitates in the healing process. Thank you. We go to the next. Therefore, I've been mentioning spirituality and spirit. What is natural for human beings is spirit and spirituality are natural dimensions that every human being has. Here, when I mention spirituality, it implies that energy and that power which emanates from the inner self. In fact, we have heard some people saying, "Hey, today, my spirit is high. My spirit is high." That does not mean that you have to relate to a particular religion or whatever. That is natural, that all human beings have spirit in themselves, which derives where they derive their energy and power from. And when I mention spirituality, this goes further and describes an awareness of relationships and connectedness with all creation, and also an appreciation of presence and purpose that includes a sense of meaning. In fact, what that statement is bringing out is that since we are spiritual beings, we use our spirituality in finding the meaning of our environment, of our relationships, and also we connect outside the world with our inner world. And that's from that point is where we create value with whom we are and the value of where we exist. And that energizes or gives power and purpose for our existence. And therefore, spirituality demonstrates that persons are not merely physical bodies that require mechanical care. Here again, as we will see, it does not fulfill for a patient who, for example, goes an amputation. And what follows from such a patient is, if it was, let's say it is a right hand which was being used and it has been amputated. In his or her mind, what goes around is, from now on, I've been using this hand of mine to feed. Now I'll not be able. What next? And many other questions comes in there. The intervention there is to give a new meaning to the patient's new situation, which really is the intervention of the chaplain, again, to know that life continues after amputation so long you are living. And from there, the patient now can start thinking of new ways which he or she can survive. And in most cases, when amputation occurs, and in our ward rounds, we find many patients who are really mentally disturbed. But when we share and with them, they bring out their concerns, then we are able to move and create an environment which she can share most of her concerns. Then, in the spirituality, persons find that their spirituality helps them maintain health and cope with illness, just like what I've shared. Traumas, losses, and life transition by integrating body, mind, and spirit. In other words, when facing a crisis, persons often turn to their spirituality as a means of coping. That's why normally you hear, Inshallah, God knows. You see, it's just you have just moved from your situation now and connected to an essence that really you give reference to take the control. And this can only be connected with your spirituality. And that, when one recognizes that, then it can be energized, as we have said, energy and power to cope with the situation, irrespective of how it is. And this makes even those who are attending to the person to have an easy time with the patient when receiving medical attention. Also, when it comes to spirituality, persons frequently attend to spiritual concerns within their religious communities through the use of traditional religious practices, beliefs, and values that reflect the cumulative traditions of their religious faith. In other words, what we are saying in this bulletin is that all patients are oriented to a particular religious community. However, when they come to a health institution like this one, and they meet the chaplains, the role of the chaplains is not to discuss his or her religion. The role of the chaplains to discuss on the spiritual concerns. But if the patient directs a spiritual concerns to a specific religious rituals, the chaplains is able to connect the person with the particular religious community for the address of the concern. But if the patient does not connect to or show any connection to a religious community, then we address spiritual or spiritual concerns as he brings out, because chaplaincy does not operate within religious affiliations. Only we connect with the religious affiliation when that need arises, but if it does not arise, then we address in respect to the context. The chaplain is with the patient. So that's how now these religious practices, beliefs, and values are addressed when it comes to a health setting. Move on. Next slide. Next slide, please. And therefore, when it comes again, as we continue the spirituality, when the person may pray or read sacred texts and observe an individual or corporate rituals that are particular to their tradition. In fact, in our unit section, normally we are connected with the Bible Society of Kenya, which provides us with sacred materials. which sometimes patients request and we deliver to them, because there are those who consult their spiritual concern through the reading of the Holy Scriptures, if they are connected to that. And there are those who connected with through the prayer, say they request you to pray with them. And also there are those who would like to feel attached to the rituals of their religion. All those happens in the hospital setup, and that is facilitated also by the chaplain when it comes to issues of spiritual expression in a hospital setting. Then we have religious beliefs are therefore important, for they can encourage or forbid certain behaviors that impact healthcare. This one, you see, as I explained, how some religious beliefs and behaviors sometimes impede the way medical care can be performed. Because if I give an example early enough, like those who do not allow blood transfusion, there are those who do not allow issues concerning organ transplant. All those are also guided by religious beliefs. But sometimes, like blood transfusion, when that one comes, the role, the intervention of the chaplain is very paramount, because now here we are dealing with the matters of life, and that's, since the chaplain understands the issues of spirituality and the concerns, he is able to move with the patient or with the guardian in respective to the responses of the medical practitioners in dealing with such a need. Other persons, again, when it comes to spirituality, focus their spirituality outside traditional religious communities and practices. Many persons with inside and outside traditional religious structures report profound experiences of transcendence or connection to the outer world, but also there is a lot of wondering of what next. However, there is also joy, but also there is connection to the nature, self, and even others, as I said there earlier. So as they strive to make their lives meaningful and to maintain hope when illness strikes. So in other words, what the issue of bringing the spirituality here is because when we are well, most of these concerns do not come on our way. When one is stricken by illness, a lot of questions strikes, and especially when one is stricken by a serious or a chronic or terminal, a lot of concern ringers their mind. And therefore, support for such is also spiritual care, because there are such leads to spiritual questions such as, why do I exist? For example, if somebody has a disease that makes him or her suffer, sometimes to drain all the resources, such kind of question coming. Then another one will ask, why am I ill? We have had situations where patients here, they say, no, this disease does not require medicine. Let me go home. You see, they attach their illness to the cultural attachments. Again, there are those who ask, will I die? Especially when some revelations are made regarding some various diseases. Even if we administer medical or other means to the patients, this one silently passes through ourselves. And it is in such a situation that the patients require the presence of the chaplain, because most of the patients believe when they see the chaplain, they see the pastor, they see a religious person, so they can discuss with them such questions to find answers to their concerns. Then another one may ask, since I've been revealed all what I'm suffering on, for example, cancer, it is in stage 3 or 4. The question which goes there now, and what will happen to me when I die? Such questions are spiritual, and they need someone to journey with you with the patients when such questions comes. So not just to attend and disappear. So the other issue of the concern, again, on the spiritual, it means that an institution that ignores the spiritual dimension from all what we have just covered in their mission statement on daily provision of care, in fact, it increases the risk of becoming only biological garages, just like the car garages, where patients are brought, they take this medicine in that, they are amputated, they are go to theater and the rest, and then they are released without knowing there are other concerns. Where dysfunctional human parts are repaired and replaced. So in fact, such vision or technical mass obscure the integrity and scope of person's care. So we can see the extent of spirituality when it comes. It's not like where the person brings in the body, just like the car goes to the garage. Here we may term the hospital, like where now they bring their body to be worked on, and after everything is repaired, you are told now go, you can function. No, there is another part of spirituality. As this patient is released, is she or he feeling comfortable in the body, in the mind, and also in the spirit? That is the most reference and concern when it comes to the spirituality in the healthcare. Next slide. Next slide, please. Thank you. Now, continuation of the 1B now. Spiritual care is relationship to healthcare. Here, I want just to highlight some areas where spiritual care is very, very, very important. And when it is administered, it really creates some healing process in the patients, but also it makes the patient to have meaning in their life as they journey through their difficult times of illness, and especially those who are hospitalized. One, as a healthcare institution, we are obliged to respond to spiritual needs because patients have a right to such services. In fact, when in areas, we thank God because of Kenyatta Hospital for having that unit, the unit of chaplaincy. Just imagine, as I've said there beginning, chaplaincy in hospitals is not well known. It is just left to quacks who normally go there knowing either they are going to injure the patients or leave the patients in a critical condition than one finds him. It is because we have not known that any patient who is hospitalized, and this is what I'm thinking from my own perspective, we need to advocate, at least from level 5. All the hospitals should have a chaplaincy, because when patients are hospitalized, there is a lot which goes in their mind and affects their spirituality. So in other words, it is their right to have spiritual care, just as they have medical care in the health centers or health facilities. So in responding to the above statement, spiritual needs healthcare institutions, when they engage spiritual care, they safeguard patients' personal dignity and respect their cultural, psychosocial, and spiritual values. Such attention flows from the belief that care of the body alone cannot be effective if mind, heart, and soul are ignored. So we will only be dealing with just a part of the patients, but not all. But when the institutions engage spiritual care to patients, it means it will be bringing in aboard a holistic care and a whole person-centered care. And I'm sure by the end, the patients leave the hospital having received the same, they refer other patients to the same institution because they have gone out having been taken care wholly. The other point of concern of spiritual care is in the healthcare, fear and loneliness experienced during serious illnesses generate spiritual crises that require spiritual care. Notwithstanding that sickness or illness is a biological event, serious illnesses frightens patients. And I'm sure as medical practitioners, sometimes we have reached a quagmire where we don't know how to reveal. And that is where now we have multidisciplinary approach to reveal some of your findings so that we do not leave a patient in shock. Frighten patients and isolate them from their support communities when they need them most. So losses such as physical and cognitive capacities, independence, work or family status, and emotional equilibrium, along with the accompanying grief, can seriously impact their sense of meaning, purpose, and personal growth. In fact, as I've said there, fear and loneliness, whenever someone is hospitalized, whenever someone is said, there is a major operation which goes on and going to be done on you, fear really engulfs these patients. And in most cases, those patients who go for such operations without receiving spiritual care really suffer a lot. And they take longer time to come back to their senses again. And in fact, even if they come back to senses again, they are left with questions of why did it happen, as the questions we asked there before. Why me? Those questions normally linger their minds. And that's why it is important that spiritual care be administered in the healthcare. The other point is that spiritual care plays a significant role when cure is not possible. We have seen how people degenerate when they come to know my disease cannot heal. And a good example is just like the time we had AIDS, when we did not know even the AIDS people can survive. When people heard they have AIDS, degeneration was high. But when the support came up, in fact, they have been able to live longer than one expected. So when cure is not possible and the patients question the meaning of life, spiritual care becomes important. Because this is a time they need compassion and comfort. It is important at this point. When there's chronic diseases and incurable, as I've said, spiritual care is very, very important. Therefore, again, approaching death can engender serious spiritual questions that contribute to anxiety, of which we know majority of our patients have, depression, hopelessness, and even loss of faith or despair. These ones, and especially in our institution, like our KNH, issues of anxiety, depression, hopelessness, and despair is what I can assure you, chaplaincy caretakers and engage with day in, day out. Because this is the moment that spiritual resource helps the patient to focus on transcendence, meaning, purpose, and value. You know, when all else seems as if it will not help, the final direction that a patient turns to is on its transcendent meaning. And this is only reached through the spiritual care. And that's why I'm saying, leaving aside spirituality in healthcare is denying patients their rights to be able to cope with the situations they find themselves. The other point is that workplace cultures generate or feel the spiritual needs of staff members, making spiritual care vital to the organization. In fact, the way we operate, leave alone the spiritual caregivers, even the doctors, even other staff who take care of these patients, as I've said, their spirit energizes and empowers when they are exposed to different situations, even them degenerate. And therefore, at such situation of cooperation and integrating and forging ways of operations, it really helps each and every person in healthcare facility. So therefore, spiritual care contributes to a healthy organizational culture. As chaplains move across disciplinary boundaries, they serve as integral members of healthcare team as they care for staff members themselves who experience the stress of patient care. Exhaustion, this is where it comes in. They not only help staff members cope, but also empower them to recognize the meaning and the value of their work. Reference, it has gone. Bring it back, please. We continue. Screen, please.
Yeah, sorry. Let me just sort it out. I don't know what happened. There you go.
Yes. Yeah, yes, I was completing the no, we are ahead of this. Yeah, we are there. And I was just mentioning now D. Let me go to E. Why spiritual care and relation to healthcare? Spiritual care is important in healthcare organization. Now, please. Oh, not there, not there. Let us go back. Let us go back. Yes, there. Spiritual care is important in healthcare organizations when the allocation of limited resources linked to moral, ethical, and spiritual concerns. In fact, for all of us who have worked in the hospital, we know there are situations which crop up, which put us in an ethical dilemma. And mostly, let's say, the life support, mostly, like I was saying, when it comes to those patients and those people from religions which do not accept blood transfusion and others, that one brings in a dilemma. And in such cases now, it is where now we have the intervention of spiritual care and taking care of such situations. Spiritual care is important. Therefore, decision either to withdraw aggressive treatment, unavoidability, such decisions interact with the personal values and beliefs of all involved. In fact, if I can give an example, I had to encounter one parent who had brought an emaciated child who needed blood transfusion, but his faith did not allow that. Though at that moment, chaplains were not involved, what I was left asking, yes, we used law and others, and since the first thing is just to save life, then others follows. When the blood was transferred to the patient, now this patient or the child was to be taken back to the mother who did not receive spiritual care. My question was, how will this mother be seeing the child whom now she believes as a foreign blood, which is that will not belong to the family? That also brings another cultural context. Our blood within our family has been mixed with a blood from another family or with another culture, because somebody you do not know from where it has come from. That brings in a spiritual concern, which really needed to be addressed, so that the mother could have had positive reception of the child, because we integrate the medical and spirituality together to bring in an answer, to help the patient, the mother, to come up with an answer that is receptive of the medical operation that the medical personnel doing to the child to revive the child back to life again. So such points that spiritual care to staff members as well as patients and families in such cases affecting the complex issues, which is the need. Let us go to the next. The next, please. Now, after saying that, I go now to the next. After I think I was just trying to cover over the issues of spiritual and spirituality, so that now, where do we fix and how are the chaplains now fixed in applying spiritual care? As you have seen the importance of spiritual care now in the hospital setting or in an organization, what or how now do the chaplains come in application of the same? I begin by stating that the basic role of the chaplain is to be involved with others in the provision of holistic care within the hospital community. So in other words, a chaplain is not a lone ledger. He is part and parcel of the hospital community in fulfilling the mandate of satisfying the patient's care holistically. And when I mention the holistic care again here, is concerned with the whole person and includes not only a person's physical health, but also their social. Social is how they connect with others. Because when a person, for example, is hospitalized, the care is either with the guardians, his care is either with the families. Also, there is an emotion which comes or crops up and goes around their mind. Also, when it comes to spiritual health, because if, for example, is a church elder or a leader in a church or a religious organization somewhere, mostly it's just like what we were saying there before, equations. God, equations, is place, equations. After now, how will I end? Will I come out here? That covers the spiritual, and it brings in what I call the well-being of the person. Therefore, chaplains in this situation become as a pastoral practitioner who seek to build a relationship of trust through compassionate presence, and thereby offer help and support to a wide range of people. I'm saying to a wide range of people because there are those who are or who are affiliated to a religion or a religious community, but also there are those who are not affiliated to a religious community. All of them, they are under the care of the chaplains, depending with their requests, depending with their spiritual needs. The way they bring out their spiritual needs is also the way the chaplains will address. Such support might, for example, focus on the emotional or spiritual adjustment to illness, or on the search for meaning and purpose through difficult times like sickness. So in other words, they help in crisis situations, including family, relational issues, as well as bereavement care, are regular areas of chaplaincy involvement in a healthcare setting. So chaplains work collectively and collaboratively alongside other healthcare professionals to provide psychosocial spiritual services for patients and their families, but also chaplains receive regular patient referrals from other staff and therefore contribute to patients' oral care through regular involvement and liaison with the members of multidisciplinary teams. That's why I said chaplaincy in an hospital is part and parcel of medical care team, because as issues continue arises, they can arise with the patient, with the chaplains who refers to the medical practitioner, or it can arise from the medical practitioner to the chaplaincy. So it's a two-way traffic, so that as they engage, they come to see that the patient's welfare is taken care of throughout her or his medical care. We go next. We go to the next place. As we continue, the chaplain's specialty is to possess a particular understanding, especially of relation between faith and illness, and the emotional and mental conflict that might arise. In other words, a chaplain seeks to motivate and initiate meaningful use of each individual's beliefs and attitudes in the management of their difficulties. So in other words, the chaplain is not to take his or her needs to the patient. It is the patient who is supposed to come up with his or her needs so that the chaplains can move with him or her to help him or her to have the meaning of his situation and the concerns. And therefore, the role is more of supportive, serving as a counselor and guide to the psycho-spiritual needs of the staff and or patients. And therefore, the chaplain's ministry to the patients is the prime responsibility but often chaplains will also come into contact with the patient's family and be able to respond to their needs as required. In fact, here he acts as intermediary. He can communicate from the patient to from the staff to the patient, or from the staff to the family member, or from the family member to the staff, and also to the patient. Therefore, when chaplaincy involves hospital staff, it forms another major area of pastoral responsibility for chaplaincy team. For they are available for staff support, but also advice, and are often involved in staff advocacy. That is disciplinary, but also in competence proceedings that normally come up as pastoral care continues. Let us continue. We continue to the next slide, please. Now, chaplain's role, that was introduction. Chaplain's role with various groups, as mentioned there above, in a clinical healthcare setting. One, who is the prime care, is the patient. A chaplain is involved in developing an integrated pastoral care ministry of support, guidance, and nurture and encouragement. So in other words, integrated pastoral care ministry of support, it cuts across to the anxiety, the hope, the meaning that one makes while is hospitalized. Those questions I mentioned there before. Why me? Where is God? That support to make the meaning of even what one undergoes is the work of the chaplain. As I've mentioned there again, the other role is providing information on faith tradition and access to resources and rituals. Just in case where the patient requires the service from his or a particular religion community, it is the work of the chaplain to liaise with the minister or pastor, but also taking care that the one who comes, or the one he or she calls to be the pastor, will not come to make it difficult for the patient to receive medication. Because, for example, there may be those who come and say, this disease does not require medicine, it requires prayers. Such, we censor them and we give them direction of how it should be done. The other one is assisting patients to cope with the psychological, social, and spiritual aspects of illness and difficulties arising from them. For example, nowadays economic situations have become difficult, and this can affect one process of healing because of the questions of where I'll get this, how will I be able to go through this. That one is also helped and assisted by the chaplaincy to help the patients know how to go about it. Then there is helping identity, helping one identify spiritual and religious filters. In fact, there are so many concerns of the spiritual needs, but we try to look, or the chaplain tries to look, which one is paramount in the same, which when it is addressed, it can take care of others. That is the role of the chaplaincy. Then offering counseling services related to problems and issues that patients might share with a professional religious work, like fear of death, guilt, and forgiveness. There are some issues which patients do not want to share with either the nurses in the ward or any other person apart from the religious personnel, because they don't know the response which they can get from others. They feel comfortable in most cases sharing with the chaplain. Also, Chaplain acts as a facilitator between patients and hospital staff, or family and patients, or family and staff as required. This one, I think I mentioned there above, and I explained it, how chaplaincy acts as a mediator between cross-sections of multidisciplinary, but also family members. There is also serving as a religious resource person for the patient. There are those who would require rituals to be done. Chaplaincy is there, and if it's not of the religion that either the chaplaincy is, then we may require or source one from our religious community. They also serve as a representative of the religious community to the institution. There are those religious communities which are represented here, and they represent the wide range of religious background. That's why they link with other religions which are not represented. Then they also involve in inviting patients to express feelings and explore the meaning of their experience about illness or other life stresses. And this eases them to go through medication and healing comfortably. They also work with the family and friends for their own healing and support of their loved ones. Mostly like in hospitals, families, there are some families when somebody is hospitalized, then it doesn't disappear, they don't come. It is also the work of the chaplain to intervene. There is also working with families, exploring spiritual resources for rehabilitation, healing, and growth. So as they share with the patients, they raise concern of spiritual concerns, then it is the work of the chaplains to figure out which spiritual resource one can use or can adopt to enable the patients to come out of concerns or spiritual concern as goes on healing, but also if a spiritual concern had come down, also to enable the patients to start building up on the same. The next, next slide, please. Apart from the patients, also the chaplains has a role to play when it comes to the staff. One is working with staff to support clients, so to support patients. So medical staff and patient and the chaplaincy, they work together, and when they work, they support one another. We reach to what we are calling holistic patient care. They also provide pastoral care services to the staff of the hospital. In most cases, where there are some extreme cases, like also when there is demise of staffs, those who they have been interacting and working, also they are affected by losing one of their colleagues. Also, there is burnout, exhaustion. Sometimes we are involved in uplifting their morale so that they know they are given a chance to serve, and that is the calling that they've been called. So when we interact and share with them, we really also encourage them as we do their pastoral to the staffs. Also, we also establish a training function, obviously like this one. We are informing about how we go in the areas of psychosocial spiritual concerns. We also facilitate groups of staff for team building and debriefing, mostly in the wards. And also sometimes we are also involved by the staffs when they are having the same. We debrief them, or they debrief us on how situations are in some cases where we need their intervention, or where they need our intervention. Also, we help other professionals identify and attend to their own needs and issues by providing staff support and valuing their particular contribution. This is when we recognize and give them support of the same. They feel good, and the staff members, and also that sometimes when they find the chaplains in the ward and they share with them, we support one another. And that is the role of the chaplain when they're engaging the staff. Also serving as an intermediary or resource person in some of the complex situations of healthcare. We say determination when some ethical issues need to be shared. I think chaplaincy and staff really have discussion to come up with a solution that will leave all the members satisfied with the direction that they take when it comes to spiritual care and health care. Finally, serving as a resource for those addressing the complex ethical issues involved in making healthcare decisions. Thank you. Mostly we're taking some serious operations, intervention of chaplains in there. Then C, we have church and community relations. As a chaplain also, we participate in assisting the churches to develop programs of chaplaincy support. In fact, that's how we have been able to create partnership with these churches to even over their donations to chaplaincy unit, which they also assist the patients who have no one to take care of. So that link with outside hospital, with those who support the hospital, it is the work of chaplaincy. So it is our work to source such churches which are willing to help us, but also we know there are some churches which have departments of chaplaincy, and linking with them, they help us to support the patients who are hospitalized here and they do not have someone to take care of them, or those sometimes when their families drop them here, they do not come back again. Also, we have a role of enlisting and maintaining volunteers program in providing holistic patient care. Volunteer, they are the same people, individuals who would like to give their hand in serving patients who are in the hospital, the same. And I thank the hospital because whenever we have such volunteers, they come, they really refer them to the hospital unit or chaplaincy unit for the same. And we work in collaboration with them to see that our patients are comfortable as they continue receiving their medication in the hospital. Next. Next, yes. Then we have a role of also coordinating the hospital religious activities. For example, supporting various staff groups, devotions. For example, which I can give in here at Kenyatta. Normally in the morning, we have staff services or staff devotions early enough before they begin work. There are departments where chaplains go and have reflection just to give them the morale of the day. That is the work of the chaplaincy that they continue. But also we have functions like hospital prayer days, which we normally organize. And also we help to synthesize the hospital, what that chaplains is there to care for their spiritual needs. And whenever such needs arise, there is a department that we can contact. And this really encourages also staff's spiritual care and spiritual needs in the hospital. Finally, controlling the distribution of religious materials within the hospital. Obviously, as I said, there are those patients who are there with us with the Bible Society of Kenya to give us religious materials, which we normally distribute also to the patients who are able to read, who want to read sacred texts. It is also our role to go and source for such materials, which we know they are good and enhance and help our patients to grow spiritually, irrespective of the situations that they are undergoing in the hospital. And we know it enables them Even if the chaplains has not been present, they are able to reflect on their spiritual needs even before the chaplains arrives. Thank you. We continue to the next. Then there are pastoral services, which you normally have. Creating and maintaining a pastoral care service department, like chaplaincy unit at Kenyatta. We have pastoral care services, which we have in the department, like now in the evenings or in the afternoons. Those who are able, they visit the mosques and they visit the chapels where there is lunchtime reflections and fellowships to boost our spiritual morale and spiritual growth. It's also led by the chaplains as guider of the same. We have also to engage in appropriate research to strengthen the pastoral services department. And as I've said, currently there's an ongoing research on spirituality and health, which will bring implications, search for implications for holistic person-centered healthcare in Kenyatta Hospital. We hope it will come with some recommendations of some areas I highlighted in the spiritual care and the role of chaplaincy in the hospital. Finally, or the same, or we maintain appropriate professional relationship with the hospital administration. So even as there are professional requirements, which chaplains engage as they work together with the hospital administration, because there is policies, rules, and regulations they see to aid or are adhered to for effective service of healthcare to the members of the hospital. We continue. The next. Next, please. Next. Then, what are the benefits of chaplaincy in the healthcare organization? This one, chaplains help healthcare organizations meet patient expectations for competent and compassionate spiritual care services. Yes, they become part and parcel of the healthcare team, and therefore doing so, they help the organization to meet the expectation of holistic person-centered healthcare. Two, chaplaincy play an important role in mitigating situations of patients' family dissatisfaction, involving risk management and potential litigations. So in some extremes, chaplaincy intervenes and really explain and help people to understand why certain actions have to be taken. Number three, chaplains can reduce and prevent spiritual abuse, acting as gatekeepers to protect patients from unwanted proselyting, those who come to save people, or who come tell people, if you are sick not because of this, it is because you don't believe or that. That's the work of chaplains, to control that. Then we have chaplains help patients and family members to identify their values regarding end-of-life treatment choices and communicate this information to other healthcare staff. Also, clarifying values and improving communication can reduce expensive unwanted care. So in other words, there are some areas where, like now, you are in the fourth stage. There we help people to realize what the doctors has revealed. We cannot go beyond that because of 1, 2, 3. So what is there is now to help the patient to come to realistic and know from here what next. And toward the end of life, how can one be in a connection with his ultimate maker, or how one can be satisfied with a situation. Next. Next. Therefore, as I come to conclusion, before I conclude, I was not able to bring in the chart of how all what I've discussed, we go about, we have what we call spiritual care intervention record, a form which we have the patient's name, the one clinic we attend, there is gender and age, which we take, where the request, if it is not our normal route, we have a section which is it initiated by chaplain, all the patients or the staff, and then we categorize the responses. Is it an emergency? Is it an urgent? Or is it a routine? And when we know the response, we ask ourselves whether it is a primary focus. What is the primary focus? Do we focus on the patient? Do we focus on the spouse? Do we focus on the family? Or do we focus on the staff? Or there is another primary focus. From there, we analyze the level of spiritual care. Is it the friend of friendship? Is it of comfort? Is it of teaching or enlightening? Is it of dialogue? Or is it pastoral counseling? Those among other categories which we analyze. Then we have nature of situation. How is the situation? Is it an advance directive? An advance directive is the last minute of the existence of the person. Then is it anxiety the patient has? Is he dealing with the issue of death, depression? Is it the issue of family care? Is it grief? Is it surgery? Is it trauma? Is it injury? Is it religious rituals? If it is that, then we know how to attend to those spiritual spiritual situations. Then we have spiritual assessment. What is the focus of visit? The focus of visit may be relationship with God, identity, helping the patient to have the meaning, issues relating to ethic. Is it giving hope? Is it doctrine regarding their religious community? Is it their community? Is it ultimate values, or there is any other? After that, we try now to know what is the spiritual intervention. Is it listening presence, just being there to listen to the patients, share our concerns or our story? We have, does it need spiritual counseling? Then another issue of concern or intervention is it consultation? Is the patient trying to consult an issue or a concern? Is it a crisis intervention, like death, bereavement? Is it grief facilitation? Is it education? Is it supportive dialogue where we share to encourage? Or intervention is giving religious rituals? From there, we come out with the desired contributing outcome. What is the chaplains intending to be the result of this visit or this intervention? And from there, we rate, giving a distinction of 1, 2, 3, 4, where 1 is the lowest and 5 is the highest. In this situation, we may have to have a referral. And then finally, do we have future spiritual plan? Or do I need to go back again to the patient again to see the progress? And from there, we write the date seen, then the time I entered and the time out. I also have the length of my visit, and then I have my signature to have the report, and I can have behind the form some narrative of what I may have found. This one I could have attached is that I do not have time, but I'll add to it so that we can see how all what I've discussed, how it is gathered, how we gather information irrespective to the presentation. Thank you, and may God bless you. Thank you, Dr. Amina.
Thank you. Thank you, Reverend. Thank you very much for your insightful and very informative discussion. I'm not sure if time would allow us to go through some couple of questions, but it's always good to engage with the listeners. Thank you for listening. And we'll try to address a few of the questions that have been asked by the audience. And
Yes.
some are mostly regarding the interrelation of chaplaincy and psychology. They seem to be a lot of overlapping, and I don't know if Pauline is still logged in. She also shared her views on how she has worked with you in the mental health department in close relation. So kindly explain and explore on that particular angle, the relationship between psychology and chaplaincy.
Thank you, Dr. Amina. Where psychology comes in and where they connect with the spiritual care is that all these questions come from the mind. They come from the mind. The distinction which comes in now is when it starts to relate with the spiritual concern of the patient. If it does not go that direction, in most cases where we have also involved the psychologist. And I can attest there are several cases where the psychologist have also gone to share with the patient. And when he notices there is some spiritual concern within the discussion, she or he has had referral to the chaplain. The same thing has happened to us, where we have engaged the patient and we have found that he does not move towards the direction of spiritual concern or ultimate reality after what is really concerning him or her, then we take it back to the psychologist. I can give a good example of such situations. We have had patients who have been prepared to go for minor or major surgery. For example, of where even we have not only the psychologist, but the medical practitioner, they have involved all the dimensions of the psychologist, chaplain, and medics, is where, for example, sometimes we had the core joint twins. The core joint twins. In such a situation, the question and the problem which really touches on the parent, not that my children or my babies are going for this major operation. The question is, will they come out? Will I be sacrificing my children by allowing them to go? These are spiritual concerns, which now a chaplain needs to intervene so that the parent spiritually, or even after that, coming back to question him or herself, or she has done a mistake, will release the children or release the person to go to this major, knowing that I am free. What God wants to do with the patient, I release to him. It's just like releasing and getting connected to the ultimate reality that may happen. This is so different from coming to just accept that since myself, I have no capability and I have no say here, there's nothing I can do. But that one now leaves somebody with a stinge that I've released, but not. And that one, psychologists come in there. So we normally coordinate when something goes beyond personal reflection and starting to question the spiritual reflection. That is when it takes that dimension now. It does not concern the psychologist, it concerns the chaplaincy. And that's what we normally major on. Because if it is the medical issue, we direct it to the medical personnel. If it is psychologist, we take it to the psychologist. But if it is spiritual concern of finding meanings of my situation in relation to my beliefs, then that is where it comes in. Because it goes beyond now the reality of what we can see, but to another realm of what I may refer ontological concern. Thank you.
Thank you, Reverend, for giving us that breakdown between spirituality and mental barriers. So a lot of people have said thank you for bringing up this discussion, starting up this discussion, and agreeing with the fact that level 5 hospitals should also inculcate hospital chaplaincy. We've talked about patients, but now I would like to speak about staff. How often do the chaplaincy engage with staff so that they can also have a better spiritual well-being to actually offer better services to patients? Over to you.
In fact, that question is what drove me to begin with this research, because for sure that connectedness is not well spread across members of staff in the institution. But there are a good number of them who really refer to the chaplaincy. But the deep detail to what I've just brought out, that one is insufficient. Is insufficient. But to the majority or to the minority, the staff, they know, but also there are some challenges which I can cite here, that mostly of the difficulties, Dr. Amina, the chaplains faces with the doctors. They have no time with spiritual matters. A good number of them, not all of them, because I know there are some who come to the but a good number. You see, when it is a good number, not the small number, then there's a challenge there. Which I think with this one, it can be brought out so that majority of them can come out to share. Because most of the times when I see them resorting, or some medical officers or practitioners resorting to chaplaincy, is towards when somebody is dying. You see, the chaplaincy is only for dying people. That is where now comes when person is dying, or towards the end and the first stage, or when somebody, or when they want to refill some chronic or a stage which cannot be reversed. That's the only time. But journeying with the person so that by the time we reach to that point, somebody has received. Because I tend to believe when a doctor receives a patient and goes with that patient to some point, even before we reach the extreme, he may have come up with either some conclusions which he either want to testing, and it is at that point that the chaplaincy needs to be coming in if the inevitable is anticipated. So that by the time somebody reaches to the end, he has come in the realization of oneself, not when someone is at the extreme. And again, this is what really makes the difference now between us again with the psychologist, because psychology is when somebody has developed this one. Because spirituality is something ongoing. Because once somebody like now in Kenyatta comes from the other hospitals and is referred, the first question is, what type of disease do I have that I cannot be treated in the hospital or a health center near my home, that I'll be sent to Kenyatta? So already there is a breakdown, which that patient is coming with. So at the initial stages, if these people can be, or the medical practitioners can realize the spiritual needs early enough, I think we can have a best way of intervening when it comes now to spiritual care and the healing of the patients, irrespective of the type of the illness the patient is having. Thank you.
Thank you. Maybe I allow Pauline to, she's a psychologist in Kenyatta. Maybe she can give her perspective, but one of the audiences pointed a very good similarity between an ophthalmologist and a neurologist. I thought that was a very nice similarity in terms of if you're having visual issues, you go to an ophthalmology, and then they see that it's actually more, it's a brain issue. So I like that, and I thought I would share. So Pauline, kindly give us a little bit of your input.
Hello, Dr. Amina. How are you? Yeah, my name is Pauline. I've been a clinical psychologist in the Department of Mental Health at Kenyatta National Hospital. And as Reverend Wega has said, I am a strong believer of the biopsychosocial spiritual model, whereby biology is taken care by the doctors, the nurses, and the medical team. As psychologists, we come in to address the psychosocial issues. And of course, working very closely with the chaplains, we incorporate the spiritual component of the biopsychosocial model. Many other times that patients would ask if they could bring along their pastors to come and probably maybe give a word of encouragement, do some rituals. So in most cases, as a psychologist, what we would do is go back to the chaplaincy in level 2, and of course, inquire Reverend Wega and his team to censor and maybe look into the pastor who is coming in. And then once they do that, then the pastor is allowed through the chaplaincy to go and attend to the patient. So I agree with Reverend Wega that, you know, we cannot ignore the component of spirituality in healthcare. So yeah, that's what I would want to say, Dr. Amina. And I really enjoyed the multidisciplinary teams that we had, and especially in level 2 where I was deployed. Many other times that we worked with doctors, consultants, and of course, bringing in the chaplaincy to address the patient's needs. And of course, patients registered, you know, they registered gratitude, especially when they felt that all their aspects were met, biological, psychosocial, spiritual, and you know, treating that patient in a wholesome way. Yeah, so that's what I would want to say, Dr. Amina. Thank you for this opportunity.
Thank you too, Pauline. Thank you very much for the opportunity as well. So, Reverend, personally, I'm really honored that you have taken your time and you've shared with us your inputs, your knowledge, and given us a different dimension on looking at a holistic view of healthcare. Personally, I'm also excited that Kenyatta also got Muslim chaplaincy recently, and surely it's been an eye opener, you know, as also a doctor practicing, to see that the patients can also reach out to different arrays, you know, and it's really a good experience. So, Father, kindly give us some parting shots before we end our session today.
Pardon, is it me?
Yes, Reverend. Go ahead.
Okay, thank you, Dr. Amina and the members for this opportunity for us to at least, and I think this is the first one of its kind. So I think the time is right for us to begin to grow and also to come with more presentation to build our chaplaincy department, but also to enhance our services to the patient. So I thank you all for giving me this opportunity again to present what I see as part of our service and the reference of the healthcare service at Kenyatta. And I'm very grateful for such an honor. Thank you. Asante sana.
Yes, asante sana, Reverend. Thank you very much for being with us, and for the audience, thank you for listening. And many apologies for the technical hitches. We will definitely improve next time. So without much further ado, asanteni sana. Take care. Have a lovely afternoon.